Hello friends, good afternoon and welcome to EduSat Live Lectures. Dear friends, today in Immunology we will be talking about autoimmunity and autoimmune diseases. To discuss this topic we have with us our subject expert Dr. Hardeep Kaur. Dr. Hardeep Kaur is Assistant Professor in Department of Zoology in Ramjas College, University of Delhi. Without further ado, I would like to welcome ma'am to our studios and request her to start the lecture. Welcome ma'am.
Thank you, Amrit. So, dear viewers, today we will be dealing with a very important subject. Of course, it is a very important subject and a very important topic in immunology, that is autoimmunity and autoimmune diseases. Now, to discuss this topic, let us understand what exactly we will be covering in this particular lecture. This lecture would be divided in two parts. In the first part, we will be dealing with what is autoimmunity, what are autoimmune diseases, causes of such diseases, and after that, in the second half, we will be taking up the types of disorders, the methods of diagnosis as well as the treatment. Now, first of all, by this time with various lectures in immunology, I am sure you know what exactly happens in an immune system. Now, immune system, as we very well know, can be divided into two components, the innate immunity and the acquired immunity. These are the two types of immunity we had. Furthermore, the acquired or adaptive immunity can be further divided into T cell immunity based as well as B cell. Now, B cell immunity is technically called the humoral immunity, while the T cell immunity is the cell mediated immunity. Of course, we have discussed all this in detail in our previous lectures. Now, this is just to refresh you what is an immunity. Now, there is a very important balance between immunity and a tolerance. Now, what happens whenever our immune system, as we always say, it has a great responsibility, it has to take care that it is in a right state, it is in a balanced state. Now, whenever there is less of immunity, we say there is a situation called immunodeficiency. So, that means too little is immunodeficiency, too much of immune system exhibition is hypersensitivity. However, a misdirected immune system is an autoimmunity. So, we must understand these three components: immunodeficiency, hypersensitivity, autoimmunity. Today, we will be discussing mainly about autoimmunity. As I just said, it is a misdirected response towards an antigen, which is primarily maybe not an antigen, but our immune system is perceiving it as an antigen. So, now we can say that in our immune system has a lot of responsibility. It has to make sure that it is producing immunity also, and it is having a tolerance towards certain antigen, like for example, the self cells. Self antigens, our body has to be, our immune system, our cells of the immune system has to be tolerant towards the self antigens. Now, mechanism of self tolerance normally protect an individual from self-reactive lymphocytes. Here I must tell you viewers that most of the times when we go in for diagnosis or checking of certain autoantibodies, we find that autoantibodies are not only present in those individuals who are inflicted with certain autoimmune diseases, but they might also be present in certain healthy individuals. Now, why it does not cause any problem in healthy individuals? Because we have a tolerance. Now, tolerance protects us, our body, from self-reacting lymphocytes, reacting to our own antigens. Now, generally when this tolerance is broken, we start having an autoimmunity. That means we start responding to our own antigens. That is what is autoimmunity in a layman's language. So, let us define autoimmunity. So, we can say autoimmunity is a failure of an organism in recognizing its own constituent parts as non-self, which allows an immune response against its own cells and tissues, or more technically, it is a breakdown of mechanisms responsible for self-tolerance and induction of an immune response against components of the self. Now, any diseases that are because of or are result of such an aberrant immune response are known as autoimmune diseases. Now, let us go back little bit to the history of autoimmunity. Paul Ulrich, he was a German scientist who worked in the field of immunology and hematology. He has various contributions, Graham Steining et al., but he also researched autoimmunity, but he specifically rejected the possibility that an organism's immune system could attack its own tissues. He called it as horror autotoxicus. However, his own student Ernst Vitebske demonstrated that autoimmunity could actually cause diseases in humans. Now, following Paul-Ulrich detection and work by his students, there was Sergei Metalnikov in 1900 who found that sperms could sometimes elicit an immune response even when injected into the same species. For example, in this case, he used sperms from a guinea pig injected into his own self. Now, he found there was an immune response production against the sperms. This was actually the basis of spermatoxins research, which inspired Margaret Sanger in 1930s to conceive of a contraceptive pills. Now, Danath and Landsteiner in 1904 identified circulating autoantibodies in paroxysmal cold hemoglobinuria. Demeshik and Schwartz in 1938 identified acute hemolytic anemia as an autoimmune disorder. Now, this is a very brief history about the autoimmunity. Now, let us come to the general features of autoimmunity. Now, you will find that whenever we detect autoimmunity in an individual, there are certain features which have been found. Like for example, there is high level of immunoglobulins in the serum, blood serum of that individual. Mostly these immunoglobulins are autoantibodies. Then there is an accumulation of antibodies, lymphocytes and plasma cells at the site of lesion. There is genetic predisposition to autoimmunity, and it has been found that these autoimmune disorders are more common in females. Almost in many of the cases it is in the ratio of 4:1, 4 for females and 1 for men. Immunosuppressive therapies are mostly effective for most of the autoimmune disorders, and they follow a chronological order. Generally, they are non-reversible. Once damage is done, it is done. Now, these are the very general features. Coming to the cardinal or the most important features of autoimmune diseases or autoimmunity, genetic susceptibility. As I just told you that it has been found that most of these autoimmune disorders are have some relevance coming from their genetic makeup. Like for example, it has been found if a person is afflicted with an autoimmune disorder, you can find a genetic linkage to it. There is a hereditary, there is a predominant chances that his ancestors is also suffering from those autoimmune disorders. So, these diseases are strongly linked to HLA, that is human leukocyte antigen genes. Of course, we cannot rule out the environmental triggers. Environmental factors like infections also play a predominant role. There are a group of 60 to 80 chronic inflammatory diseases. Now, various effector mechanisms are responsible for tissue injuries in different autoimmune diseases. Now, let us come one by one. Now, as I just said that there is a bias towards females or ladies specifically for autoimmune disorders. Now, as per a study conducted at National Institute of Health NIH, women were found to be 3 times more susceptible than men to develop autoimmune diseases. This is a data from a 2014 paper. The most common among these are the middle-aged women, maybe mostly like 30 to 40 or 20 to 40. Now, aging, stress, hormones, pregnancy, they might be a very important component of autoimmune disorders, as it has been found most of the times if a female has gone through a pregnancy, generally autoimmune disorder starts post pregnancy or sometime in the middle of the pregnancy. Most of them are not even aware that they are suffering from autoimmune disorders, and during the gestation or maybe after parturition, most of them come to know that they are actually suffering from an autoimmune disorders. Now, another very important finding is that left-handed individuals are also more affected. 11% of left-handed and 4% of right-handed are found to be suffering from autoimmune disorders. Now, again, the reason behind this are ambiguous. left-handedness and immune malfunction may be due to abnormal endocrine function in the fetal life, but we do not know for sure why left-handed people are more inflicted with the autoimmune disorders. Now, the examples of certain autoimmune disorders are multiple sclerosis, Misty Nia Gravis, Crohn's disease, Graves' disease, type 1 diabetes mellitus, rheumatoid arthritis, psoriasis, scleroderma, systemic lupus erythematosus, commonly called SLE or lupus. Now, let us come to the mechanism behind autoimmune disorders. Now, very important mechanism being neoantigen. Now, what happened during neoantigen? Sometimes our normal body cells or tissues come under contact with certain chemicals or biological agents, or at times due to physical liberation. Now, these cells or tissues who are depicting the self antigens, these self antigens may get altered due to alteration, they get altered due to contact with the physical, chemical or biological agents. For example, the most common one is contact dermatitis, which is a delayed type hypersensitivity, which we had done it in the previous lecture on hypersensitivity. It is a type 4 hypersensitive reaction. It is a typical example where normal body cells are coming in contact with certain chemical allergens. Now, if you remember, I told you about certain nickel present in the watch strap, which causes certain delayed type, DTH type of hypersensitivity reaction, or the type 4 type of hypersensitivity reaction, wherein your normal body cells have gone certain alteration due to the chemical found in the watch, that there it was the nickel. Now, drug or therapy induced anemia or nephritis could also come in this category. Now, mutation could also be the cause of neoantigen formation. So, the causes may be known, may not be known, but what has happened is the self antigen has got altered because of any whatever reason, mutation, physical, chemical, biological, any reason. Now, this self antigen have become a neoantigen and is now leading to a immune response within the body. Now, another important reason for autoimmunity could be similarity between foreign and self antigens, which could lead to cross reactivity. For example, streptococcal group A proteins and muscles of the heart have marked similarities and therefore could befool the system. Now, if there is a streptococcal infection, the autoantibodies which are produced against this can also affect the heart muscle, and it could lead to rheumatic heart diseases. This is because of similarity between foreign and self antigen or cross reactivity. Now, there is another situation which is called molecular mimicry. What happens here? There is a similarity between the foreign antigen and the self antigen, but it is restricted to certain epitopes only, hence confusing the immune system. For example, there are certain epitopes which are common between Mycobacterium tuberculosis and the joint membranes. So, what happens? The antibodies produced against this bacterium, that is Mycobacterium, can have an effect on the normal cells present on the joint. It can have certain deleterious effect. Of course, it is an immune response produced against the membrane of the joints, and which will cause immune reaction. It will start the breakdown of the joint tissues. Now, this is called molecular mimicry, where certain epitopes are similar. Now, there is a very important cause of the autoimmunity, which is the hidden or sequestrated antigen. Now, sequestrated antigens are those antigens in the body which are hidden from the cells of the immune system. Now, what happens if there is a damage to these organs? Now, it leads to the exposure of these sequestrated antigens or hidden antigens to the immune system. Once immune system who has not been acclimatized to these antigens, these hidden antigens, see these come in contact with these hidden antigen, it will mount an immune response. So, exposure of these hidden antigens to the immune system leads to an immune reaction to these antigens. For example, the lens of an eye. Now, if you see certain immunologically privileged sites in our body, these are the brain, the eye, the testis, uterus in the fetus, or hamster cheek pouch. Now, what happens? Any of these cells present in these regions within human, what will happen? The immune system has not been exposed to these these cells which are present in these organs. Now, because of any reason, let us say a trauma to an eye surgery, whatever, certain cells escape from these tissues. What will happen? They will come into the body will mount an immune response against it, because it has never come in contact with these cells. Such cells are generally called the hidden antigen or sequestrated antigens, and as I just said, they are generally present in certain privileged sites. These sites are under constant immune surveillance. However, post trauma and infection, tissue barrier gets disrupted and our immune system hence mount response against the cells present in these immunologically privileged sites. Now, mutation, as they say, sometimes it is called forbidden clones. Now, clones of changed or altered lymphocytes. Now, alteration in a lymphocyte could be due to a mutation. So, it causes these lymphocytes to become self-reactive. Now, and hence because they become self-reactive, they will start recognizing the host as a foreign. Now, there is another reason called polyclonal B cell activation. Now, many viruses and bacteria were called super antigens because they have plenty epitopes on themselves, or certain chemical stimuli can turn on many self-reactive B lymphocytes. You see, generally a one epitope will lead to a production of a particular type of an antibody. Now, because there are so many epitopes present on the surface of these viruses and bacteria, they will lead to poly B cell activation, and sometimes these B cells are self-reactive. Now, the nature of these antibodies which are produced by these B cells is generally IgM, which is very similar to the ones which are generally produced in the normal immune response. Now, for example, the lipopolysaccharide, the LPS produced by gram-negative bacteria, it is an endotoxin which can cause polyclonal cell activation. It is a typical example where LPS leads to polycell activation or polylymphocyte activation. Now, of course, we cannot rule out the genetic factors. It is a well recognized fact that certain immune disorders are predominant in females and in certain families. Now, it is determined by the family studies. If we take a study of we check the pedigree chart or the family study of a particular family, of an individual's family study, we will find there would be many individuals afflicted with the same disease. There is genetic links that have occurred between diseases and HLA antigens. Now, for example, in multiple sclerosis, there is a greater concordance in monozygotic than dizygotic twins. Please understand, the monozygotic twin is coming from a single zygote. Now, these twins, if one is afflicted with a particular disease, the second is also afflicted with the same disease, thus indicating that genetic factors are very important. However, here this concordance in monozygotic twins is not absolute, it is not complete. That suggests that there might be a role for the environmental factors as well. So, sometimes there are certain lymphocyte abnormalities. Now, primary abnormalities either in B cells or T lymphocytes could be present, which are critical regulators of all immune responses. Now, MHC presentation of all antigenic peptides to these cells will hence be defective in case the cells are abnormal. Now, abnormalities in lymphocytes could affect any one of the mechanisms that are very important for self-tolerance. Any abnormality in lymphocyte will break down this tolerance and would lead to autoimmune reaction. Now, breakdown of immunological homeostasis. Now, as I just said, that tolerance to self antigen is inbuilt during maturation and differentiation of immune cells. We had done in our previous lectures that how during the process of immune cell formation, there is a chances that most of these lymphocytes go through a process called immune elimination. In what happens is, most of the lymphocytes that are self-reactive, that they are removed, they are destroyed, and also those lymphocytes that are not reactive to foreign antigens are also destroyed. So, only those lymphocytes that are acting against the foreign antigens are taken care. So, technically almost maximum of the lymphocytes they are destroyed, only 20% of lymphocytes are retained which are not self-reactive and which are reacting to the foreign antigen. However, the breakdown of this homeostasis due to any reason can cause total collapse of tolerance to self-antigens. Mutation or loss of immune regulatory power may cause such a situation. As you can see in this diagram, most of the lymphocytes that are self-reactive, and this is called negative selection or death of the cells with high affinity receptors for self-MHC. They are just removed, and only those immature CD4 or CD8 positive T lymphocytes are kept in the immune system which are reactive to the foreign antigens and are not self-reactive. Now, with this we come to the classification of autoimmune diseases. Most of the autoimmune diseases are classified on the basis of the site that is involved and the type of the immune response that is produced. Now, autoimmune diseases can further be classified into hemocytolytic diseases, localized or organ specific diseases, systemic or non-organ specific diseases, and transitory diseases. Now, all these autoimmune diseases are classified not only because they are organ specific or non-organ specific, they are classified according to their behavior also. For example, when I am talking about the hemocytolytic diseases, now most of these hemocytolytic diseases are those which are against the blood cells. Okay. Now, most of them will be autoantibodies would be directed towards the blood cells. Now, we can call them as systemic also. Now, we must understand what is a systemic and organ specific thing. When I say organ specific, here what is happening is the autoimmune antibodies are produced against certain antigens of a particular organ. So, what happens is whatever reaction that is going to take place will take place in that organ itself. It will be limited to a particular organ. However, on the other hand, in case of systemic or non-organ specific diseases, what will happen? The autoantibodies will be produced against maybe the antigens which are present throughout the body. So, it can be a systemic. Now, of course, organ specific, systemic both can be maybe for a shorter time or maybe a chronic. Most of the times the autoimmune disorders are chronic in nature. Like for example, once they are onset, they go on for a long time. Now, the fourth category which we said is the transitory disease. It's those diseases that happen because of certain disease. Like for example, we are afflicted with certain major disease. Post that disease, we are facing certain more problems like anemia or many other things. Now, those are transitory in nature. That's for a short time. So, as I just said that they can be short time or they can be chronic in nature. Now, most of these transitory diseases are because of certain other disease. So, based on this, these autoimmune diseases have been defined as hemocytolytic, localized or organ specific, systemic or non-organ specific, and transitory diseases. Now, to describe these diseases in detail, we will come to our next part of the lecture. Thank you so much. Welcome back viewers. we were discussing autoimmunity and autoimmune disorders. Till now we should be clear what is an autoimmunity. Autoimmunity is when our body starts mounting an immune response against our self antigen. As in my previous lecture I described, there is a tolerance to our self antigens. This tolerance is a property of our immune response. Now, even if we have it is a very big immune system, but our immune system has been acclimatized to all the cells of our body and all the antigenic peptides that are present on the cells of our body. So, naturally when you are supposed not to produce an immune response against this self antigens. However, certain times this tolerance gets broken down. So, we can say it is a misdirected immune response towards our self antigens. Now, we described this as a property which is called an autoimmunity. Now, all the diseases which is a consequence of this autoimmunity are called autoimmune disorders. Again, previously I described that all these autoimmune disorders, in all these cases, most of the times these diseases are genetic in nature, running in the family, mostly predominant in the females. I also said in certain left-handed individuals also these autoimmune disorders are present. And then we further described what are the causes of these autoimmune disorders. In these we described certain things called neoantigens, where our self antigens have undergone certain transition or certain change due to exposure to certain physical trauma or to certain chemicals or due to biological agents like mutation maybe. Now, all these self antigens have got altered and now they will be called as a neoantigen. There were various other reasons, like for example, of course I told you the mutation, then for example the polyclonal B lymphocyte, self-reactive B lymphocyte activation. Then there could be certain hidden or sequestrated antigen which for example the immune response or the immune system has never come across those antigens or those cells with those antigens. So, because of a trauma, let us say for example certain lens cells, eye lens cells. Now, most of this eye protein or lens protein is present encapsulated within a capsule, encapsulated. So, what happens? Because of a trauma to the eye, they come into the system. Once they come into the system, the immune response is produced against them. So, technically, because of any what reason, maybe a neoantigen or sequestrated antigen, or because of a mimicry, like for example, a foreign antigen is mimicking a self antigen, or certain epitopes are common between the foreign antigen and the self antigen, certain epitopes are common, or maybe the genetic reasons due to HLA genes. There are certain genes, HLA we know human leukocyte antigen genes. Now, those genes are characteristic and in certain families. Now, we know that these are the HLA antigens are similar in a particular family. Now, if a particular individual in a family is afflicted with an autoimmune disorder, and if we go and study the family history, we will find that many individuals prior to this individual were also afflicted with certain the same disease. Now, it could be certain environmental factor, for example, an infection, pregnancy, whatever reason might be, it has triggered the occurrence of this autoimmune disorder. Now, all these factors are leading to autoimmune diseases. Then we described that we can classify autoimmune disorder, as you can see, into hemocytolytic autoimmune disorders, localized or organ specific autoimmune disorders, systemic or non-organ specific autoimmune disorders, or transitory autoimmune disorders. Now, we will come one by one to each type of autoimmune diseases. Now, first of all, the hemocytolytic autoimmune diseases. Now, here as the name suggests, the autoantibodies in this disease are directed towards the blood cells. Now, autoimmune, the typical example is autoimmune hemolytic anemia. What happens here? The autoantibodies are produced against the RBC antigens. We all know that RBC is flowing in our blood. Now, what happens when the autoantibodies are produced? These autoantibodies will combine with the RBC and this lead to immune complex deposition. Now, because of this immune complex deposition, it can have great impact. It can lead to deposition at various places in the blood vessels, causing hemorrhages and etc. So, it can be very dangerous since it is kind of a systemic disease. It can occur anywhere in our body. Now, there is another type which is called autoimmune leukopenia. Here what happens, the autoantibodies are directed against the leukocytes specifically. For example, in case of systemic lupus erythematosus, which is also very commonly called lupus or SLE, the autoantibodies that are produced are specifically against these leukocytes or WBCs. Now, of course, WBCs are going to be there in the entire body. So, autoantibodies will be produced against the leukocytes in the entire body, again leading to various deposition of immune complexes at various regions. Now, as you can see, many things, many symptoms of systemic lupus erythematosus are a low grade fever, photosensitivity, ulcers in the mouth, aches, arthritis, inflammation, and a very typical butterfly rash which we will come across in our later lecture, fatigue, loss of appetite, many other things. Another very important hemocytolytic autoimmune disease is autoimmune thrombocytopenia. As the name suggests, here the autoantibodies are particularly directed against platelet membrane. It is called an idiopathic thrombocytopenic purpura, where a person afflicted with this disease will have patches at various places, purple patches developing at various parts of the body. This is called autoimmune thrombocytopenia. Coming to the next type, which is a organ specific and non-organ specific or systemic autoimmune diseases. Now, let us understand the organ specific, how the organ specific disease is different from a non-organ specific or a systemic disease. Now, as the name suggests, organ specific, the autoimmune attack is against the self antigen of a given organ. It is in a localized place. It results in a damage of the organ structure and the function, and basically the treatment would be focused on replacement of that organ function, because once damaged, most of the times the autoimmune diseases are non-reversible. However, in case of non-organ specific or systemic diseases, what happens is the widespread self antigens are targets for autoimmune attack. The damage can affect such structures as blood vessels or cell nuclei. Now, for example, when they start affecting the blood cells, what will happen? It will cause the deposition of immune complexes at various places, leading to blockages. Now, blockages in the blood vessels will cause hemorrhages, or it can also lead to a total heart failure, or maybe sometimes strokes also. So, the treatment is mainly aimed to inhibit excessive activation of the immune system. Now, furthermore, to know more about the organ specific and non-organ specific, the Hashimoto thyroiditis, Thyrotoxicosis, which is also called the grave disease, Addison disease, atrophic gastritis, juvenile diabetes mellitus, multiple sclerosis, they are all type of organ specific autoimmune diseases. While on the other hand, if we talk about the non-organ specific autoimmune diseases, we have systemic lupus erythematosus, rheumatoid arthritis RA, scleroderma, dermatomyositis, mixed connective tissue disease MCTD, or Sjogren's syndrome is also a type of non-organ specific autoimmune disease. Now, coming first to the localized or organ specific autoimmune diseases. Now, immune response here is targeted to certain organs. For example, maybe to certain specific antigens present on the cells of that organ. For example, in case of Hashimoto disease, which is also called lymphadenoid goiter, autoantibodies specific to thyroglobulins and thyroid peroxidases are produced, and it sensitizes TDTH specific, which are specific for thyroid antigens, are produced. Now, what happens? These thyroglobulins and thyroid peroxidase have a very important role in production of thyroid hormones. Now, once autoantibodies are produced against these thyroglobulins etc., will become deficient, the body becomes deficient in the thyroid hormone and leads to a goiter situation, which is called Hashimoto disease. There is another where the process is different. In thyrotoxicosis, which is called Graves disease, the autoantibodies, which are also known as LATs, LATs is long acting thyroid stimulating antibodies, are produced against the TSH receptor. Now, you must understand, TSH is thyroid stimulating hormone which is produced by the brain. Now, TSH stimulates thyroid gland to produce more of the thyroid hormones. We all know that thyroid hormones have a very important role to play in making our, letting our BMR at a right level. Now, BMR is the basal metabolic rate. Now, once there is a deficiency of the thyroid hormone, the decrease of thyroxine and triiodothyronine leads to a decreased BMR and various symptoms like obesity, etc., which is the situation is called hypothyroidism. Now, what happens in this particular case, unlike the previous where in Hashimoto disease the autoantibodies were against the thyroglobulins, here what happens, the autoantibodies is against the TSH receptor which are present on the thyroid gland cells. Now, once this autoantibodies comes and binds to the TSH receptor, it leads to overstimulation of the thyroid glands due to absence of regulation. Now, what happens here, it is very different. Here the thyroid hormones which are produced are overtly produced. More of thyroid hormones are produced. Here it is not hypothyroidism, it is hypothyroidism. More and more of thyroid hormones are produced. There is a onus on the thyroid gland to produce more of these hormones. Because of production of overproduction of overworking of thyroid hormones, thyroid gland, it will start swelling up. This is called thyrotoxicosis. It is much different from Hashimoto. Hashimoto is underplay of the thyroid gland, while thyrotoxicosis is overplay of the thyroid gland because of overstimulation due to binding of autoantibodies at TSH receptor. There is another disease called Addison disease, where the autoantibodies are against the adrenal glands, which is leading to no cortisol and no aldosterone. Now, we know that cortisol and aldosterone are very important hormones which are produced by the adrenal glands. Now, cortisol is the one which regulates our body reaction to stresses. Now, and we all know that aldosterone is very important to regulate the sodium potassium level in our body. Now, because the autoantibodies are against the adrenal gland, it will lead to deficiency of cortisol and aldosterone production, hence causing a very dangerous effect in our body. Now, there is another disease which is called Misty Nia Gravis, where the autoantibodies are produced against the acetylcholine receptor. Now, we will study each of these diseases one by one. Now, production of autoantibodies against the acetylcholine receptor will lead to complement mediated degeneration of these receptors. This further weakens the skeletal muscles. So, coming first to Hashimoto disease or lymphadenoid goiter, as I said, it is a type of autoimmune thyroid disease in which the immune system starts attacking and destroying the thyroid gland. The autoantibodies are produced against the thyroid gland. The thyroid helps set the rate of metabolism, that is the rate at which the body uses the energy. Now, what happens? The Hashimoto's prevent the gland from producing enough of the thyroid hormones for the body to work correctly. It is the most common form of hypothyroidism or underactivity of the thyroid gland. Now, here as you can see further, in Hashimoto disease, or which is also called lymphadenoid goiter, it is an organ specific disease and it is most commonly seen between in the women of age 30 to 40 years old. Sometimes maybe because of genetic predisposition, latest it has been found it can be because of the way they are leading the life, it can be lifestyle related diseases also. However, we say that most of the times Hashimoto is because of the genetic predisposition. It is the commonest cause of hypothyroidism. The causes diffuse hyperplasia in the gland resulting in development of a goiter. Now, thyroid autoantibodies are formed and these antibodies are specific to the thyroglobulins and the thyroid peroxidases, as I just said. Now, this causes an enlarged and inflamed hyperfunctioning thyroid gland, which is called goiter, as you can see in the picture. Now, in the next case, which is called thyrotoxicosis or the Graves disease, the autoantibodies, as I just said, LATs, they are called long acting thyroid stimulating autoantibodies. These autoantibodies are specifically against the TSH receptor. As you can see, what happens in a normal cases, pituitary gland is producing TSH. This TSH hormone is binding to the TSH receptor and stimulating the hormone synthesis. Now, of course, once these thyroid hormones are produced, there is a negative feedback control. If there is more of thyroid hormone, it will produce a negative feedback control and will tell pituitary to produce less of TSH. However, in case of Graves disease, what happens? There is an autoantibody present which binds to the TSH receptor and mimics what TSH is doing. So, more of stimulation of the thyroid gland will stimulate more synthesis of hormone. Now, over synthesis, of course, this is there is no regulation to it here, there is no feedback regulation. So, more and more of thyroid hormone is produced. More activity of thyroid hormone will cause overproduction of thyroid hormones and overproduction by the thyroid gland. Thyroid gland is working more efficiently here. Now, we cannot say efficiently because it is not efficiency, it is too much of production of a thyroid hormone. Thyroid gland is actually under stress to produce more and more of these hormones, hence leading to its inflammation. Now, there is another of this disease which we discussed, Misty Nia Gravis, where the autoantibodies are blocking the normal binding of acetylcholine to its receptor. Normally, acetylcholine which are produced in the neuromuscular junction or neural junctions, these acetylcholine will bind to the acetylcholine receptors and will cause sodium influx and muscle contraction. This is happening in a normal case. However, in Misty Nia Gravis, what happens? It causes these autoantibodies are produced which block the normal binding of acetylcholine receptor to its receptor. So, they are sitting on the receptor and it is not letting acetylcholine come and bind to the receptor. Now, because of this, there is no sodium influx and no muscle contraction, and hence there is a weakening of skeletal muscles in this region. Now, more of localized or organ specific autoimmune diseases are autoimmune orchitis or autoimmune diseases of the testes which leads to infertility. Autoimmune diseases of the skin like scleroderma, psoriasis, dermatomyositis, epidermolysis bullosa and bullous pemphigoid. Autoimmune disease of the eye, very important, is phacoanaphylaxis, where there is autoimmunity to the lens protein of this eye, and because of the trauma due to surgery or due to some injury, these lens cells come out which were encapsulated before and are coming into the system, and the immune system is recognizing them as a foreign antigen. It could also be sympathetic ophthalmia, for example, the bilateral diffuse granulomatous uveitis or autoimmune inflammatory response towards ocular antigen. Here what happens, because of a trauma to a particular eye, these lens cells are coming into the circulation. Now, what happens here, the autoantibodies are affecting both the eyes. Now, once they start affecting both the eyes, it may lead to a total blindness in this case. Pernicious anemia, where there is a destruction of parietal cells of the stomach causing inactivation of intrinsic factor by autoimmunities. Now, intrinsic factor is very important for vitamin B12 absorption. Now, once these intrinsic factors are inactivated due to autoimmunities, it leads to predominant vitamin B12 deficiency in these cases. Autoimmune diseases of nervous system like multiple sclerosis, where there is destruction of myelin sheath. We know myelin sheath is coating the nerves and very important for a nerve transmission. Now, once these autoantibodies are destroying the myelin sheath, it will cause the entire nervous system is going haywire. So, the myelin sheath may be the destruction is in the central nervous system, or it could be the destruction of the myelin sheath in the peripheral nervous system. Once it is in the peripheral nervous system, we call it as a Guillain-Barré syndrome. Now, with this we come to the non-organ specific or systemic autoimmune diseases, where the immune response is directed towards a large range of self antigens and a damage of a number of organs and tissues takes place. It is systemic in nature and occurring in the entire body. For example, the systemic lupus erythematosus or SLE or lupus as we call it. Here what happens, the autoantibodies are formed against a variety of tissue antigens which could be DNA, histones, RBCs, platelets, leukocytes or even the clotting factors. Now, organs affected are multiple. They could be lung, heart, liver, kidney, joints, skin, blood vessels, nervous system. So, it is in a systemic manner lupus is occurring. Now, it is more common in African American and Hispanic women. Now, generally it has been found that lupus there is a predominance of periods of acute illness which is called flare in lupus, which is generally followed by a period of latency where there is not much of a symptoms and the disease is not too preponderant. It is called a remission period. Now what happens in systemic lupus erythematosus, as I just told you previously, if you have to diagnose SLE, there is a butterfly rash which forms in lupus. It is a chronic systemic inflammatory disease, as I told you, caused because of immune complex formation which is getting deposited at various places. Now, the word systemic means that the disease is affecting many parts of the body. Now, pathophysiology associated with clinical features which is secondary to immune complex depositing in tissue results in inflammation in these regions. Now, most of the parts, as I just told you, that are affected are joints, skin, kidney, heart, lungs, blood vessels and brain. And as you can see in this slide, this butterfly rash is the first signal or the first symptom of SLE. Now, another very important non-organ specific systemic autoimmune disease is rheumatoid arthritis. Now, it is a chronic disorder mainly affecting the synovial tissue. Now, synovial tissue is present in the joints. Now, what happens? The damage is because of the rheumatoid factor or RF factor or also called autoantibodies. Now, autoantibodies once formed, they will start eating away the synovial tissue. It is a very colloquial way to say it starts binding to the synovial tissue and can start degrading the synovial tissue. Generally, again, women are found to be 3 times more prone to this disease than men. It typically strikes at ages between 20 and 40, but can occur at any stage actually. You will find autoimmune, specifically rheumatoid arthritis, even in women younger than this particular age. The 3 major symptoms of arthritis are joint pain, inflammation and stiffness. Now, progression of the disease is very variable. Now, when many organs, many joints are getting affected, we call this stage as polyarthritis. Now, this is a situation where there is a normal joint. You can see in the synovial cavity, the synovial membrane is present. Now, in case of osteoarthritis, it is basically leaching up of the bone. But in this case of rheumatoid arthritis, the autoantibodies are specifically produced against the synovial membrane and it is causing the degradation of the synovial membrane, finally loss of space in the synovial cavity. This is a typical example of rheumatoid arthritis. Now, another non-organ specific or systemic autoimmune disease is Polyarteritis Nodosa or called PAN. Systemic vasculitis, and it is differentiated by inflammatory lesions in the arteries causing microaneurysm formation. Now, you must understand in most of these systemic diseases, because of the deposition of immune complexes in the blood vessel, aneurysm is a very common phenomena. Aneurysm can be major or micro. Now, if it is a major aneurysm, it can lead to maybe stroke, maybe heart failure, maybe any reason, anything can occur, maybe kidney failure also if it is in the renal vessels. Now, in another disease called Sjogren's syndrome, here the autoantibodies are against the mucous membranes and moisture secreting glands of the eyes. Now, typical symptom in this case is the dry mouth and dry eye syndrome. Now, there is another disease called dermatomyositis. Now, here what happens, the connective tissue disease is accompanied with inflammation of the muscles. It is also called inflammatory myopathy and the skin. Now, the muscles as well as the skin, there is an inflammation over there. Now, this is very common in lungs, esophagus, hearts, and joints are also affected in this case. Scleroderma, also called systemic sclerosis, is a connective tissue disease. Here what happens? The connective tissue is the autoantibodies are produced against the connective tissue. Again, very important symptom is, if we check, if we go for diagnosis, we will find that there is a increased level of collagen production in this case. Now, with this we come to the transitory disease or the last type of diseases. Now, as I just told you, transitory diseases are those diseases that follow or trail certain infections. For example, we are having a drug therapy due to certain infection. Now, long term drug therapy or certain other disease, that is the primary disease. Now, most of these transitory autoimmune disorders are the secondary manifestation. It is after the primary disease has affected that the individual is getting afflicted with this transitory disease, or we can say they are the outcome of a primary disease. They are generally short lived, and they have generally received, once the primary disease symptoms are removed, or primary disease, a person once he gets cured of the primary disease, he will automatically get cured of the secondary disease after some time. So, they are transitory in nature. Some of the very important transitory diseases are, number 1, anemia. Here there is a decrease in the number of red blood cells or hemoglobin in the blood. Now, this, as I just told you, it is transitory in nature, generally followed after most of the diseases, that a person is found to be anemic, and as the symptoms of primary diseases are removed, the person comes out of anemia automatically. Now, thrombocytopenia, it is a decrease in the level of thrombocytes or platelets in the blood. Nephritis. Nephritis occurs because of inflammation of the kidney along with glomeruli, tubules or interstitial tissues surrounding the glomeruli and tubules. Now, I hope you have understood the various types of autoimmune disorders. Now, most of the times all these autoimmune disorders are due to humoral immunity and sometimes also due to the cell mediated immunity. Generally, it is because of the autoimmune disorders or autoantibodies that are produced, and of course, when I am talking about autoantibodies, it is because of the humoral response. So, when I am talking about the pathogenesis of autoimmune disorders, so humoral response is mostly prevalent or mostly common, but we cannot undermine the T cell mediated or the cellular immunity response as well. For example, when we are talking about certain diseases like dermatitis, where it is predominantly because of TDTH types of cells, that is delayed type of hypersensitivity cells. Now, in that particular case, it is generally mediated by the cells. So, we cannot overrule that autoimmune antibodies are the only reason. The cell immunity also has a role to play in the autoimmunity. Now, how to undergo the diagnosis, how to find out that a person is suffering from autoimmune diseases. Now, for accurate diagnosis, the review of the history, symptoms, physical examination combined with certain blood tests are very, very important. Now, depending on the autoimmune disorders, various tests can be performed. For example, detection of serum autoantibodies. One can check whether these autoantibodies are present in the serum. Now, routine immune fluorescent screening of thyroid, liver, kidneys and stomach along with agglutination tests for rheumatoid factors, thyroid and red cell antibodies, and by radioimmunoassays (RIA) for intrinsic factors and acetylcholine receptor antibodies. We can also go for solid phase ELISA. ELISA is enzyme linked immunosorbent assay which detect antibodies to the DNA or to the nuclei. Of course, complete blood count (CBC), erythrocyte sedimentation rate, that is ESR, as well as C-reactive protein detection also helps in understanding whether a person is suffering from autoimmune disorder or not. Now, once it has been established that the person is suffering from an autoimmune disorder, we have to go for a treatment. Now, the most important treatments for autoimmune disorders are as follows. Now, first of all, we have to go for immune suppression. Now, most of the immune suppressive drugs are corticosteroids like prednisones, and certain non-steroidal drugs, which we say non-steroid anti-inflammatory drugs or NSAIDs, such as azathioprine, cyclophosphamide, mycophenolate, sirolimus or tacrolimus. All these drugs are used to immunosuppress. That means we are suppressing the immune system. We have established there is a production of autoantibodies. Now, what we have to do is we have to suppress the immune system in these individuals. This can be done by corticosteroids also or by NSAIDs also. Now, in certain rare cases, we might have to go for removal of thymus altogether, which is called thymectomy, specifically in certain cases like, for example, MG patients. Now, there is another situation which is called plasmapheresis. Now, plasmapheresis actually means removal of the antigen antibody complexes. Now, as I just told you, in most of the systemic cases, the antigen antibody complex or the immune complex starts depositing at various places, for example, in blood vessels or in the renal vessels. Now, because of this deposition of the antigen antibody complexes, it leads to aneurysm. The aneurysm could be microaneurysm, it could be a macroaneurysm. Now, because of aneurysm, it can have a long term effect depending upon the extent into renal failure, into a heart failure, into a stroke. So, it can affect anywhere depending on where the aneurysm is taking place, where the blockage is taking place. So, the effective means to provide, but it is a short term thing, that you just remove the immune complexes from those regions. Removal of immune complexes will cause the flow of the blood to become normal, but of course this is a very short term thing, and again this immune complex may get deposited. Now, we can also block MHC, that is major histocompatibility complexes, with certain similar peptides. Now, we can also do blockage by anti-CD4 monoclonal antibodies. We know CD4 receptors are present on the T lymphocyte. What if we produce certain monoclonal antibodies which go and binds to the CD4 receptor and will not cause the T lymphocyte to start reacting to the self antigen? Similarly, anti-IL-2, interleukin 2 receptor monoclonal antibodies. IL-2 is a cytokine which is produced by T lymphocytes. Now, what happens if we have certain lymphocyte which is going and binding to the IL-2 receptor? The IL-2 will not have its effect, will not trigger the immune system, will not cause the production of autoantibodies by the B lymphocytes. Now, this IL-2, once it does not trigger the B lymphocyte, no autoantibodies will be produced, and hence we can achieve our aim. We can also go for blood transfusion or plasma exchange. Of course, these are drastic moves. Then the replacement therapy, very common. For example, in Hashimoto thyroiditis, we are not having thyroid hormone production. So, in such cases, we have to go for a replacement therapy. We have to substantiate the less thyroid hormone that is produced by the body from external sources. We have to take up the thyroxine hormone from outside. So, replacement therapy to replace a hormone or vitamin that is lacking in the body is another means of treating the autoimmune disorders. So, with this, friends, I come to the end of my lecture. I hope autoimmunity and autoimmune disorders are very clear to you. Thank you very much.
On that note, I would like to thank ma'am for this very enriching discussion, and thank you dear friends for watching our show. Stay tuned and keep watching. Thank you.